My research is focused on equitable digital transformation in healthcare. There are a lot of really cool IT tools, there's AI, there are predictive models, there are all these new tools that are becoming available over time, but my concern is that those tools are not equitably available across healthcare organizations. Some hospitals have the capacity to design these tools themselves. They've got the capacity to make sure that the tools function well for their patients. But a lot of organizations like federally qualified health centers or critical access hospitals in rural areas don't have those resources. Minnesota actually has the highest number of critical access hospitals in the country, providing healthcare to rural residents. But by definition, they're small. And so that means that they have particular challenges in finding data scientists and hiring them, or accessing health informatics expertise in these small rural areas. FQHC clinicians are overburdened. They're working really hard to see large patient populations and provide all the care they can. So if we could reduce their documentation burden with an AI tool, it could help them the most. But the problem is that they can't be confident, they can't be sure that that tool is really going to deliver on its promises. The situation is that they've got kind of two suboptimal choices. You can either avoid AI because you don't know how to use it safely and you can't evaluate it and make sure you're protecting your patients, or you can use it and not be able to conduct those evaluations that we know are necessary. Both of those are bad choices. We don't want our critical access hospitals or FQHCs sitting with those choices. We want to think a little bit more creatively about how policy can actually support them in trying to find where the value is in AI. So my research is a pilot project. It's a qualitative interview project that I'm conducting with critical access hospitals and federally qualified health centers, these kind of under-resourced settings, to understand how they're approaching the AI landscape. I kind of approach these questions from two perspectives. The first is to understand how health systems are making decisions. What are we using? How are we using it, and why? And how are we keeping patients safe? We're thinking about inequality as we're doing this. And then from the patient perspective, how do people think about these tools being used in their healthcare? Are they comfortable with it? Are there implications for trust and engagement? And what are the implications for inequities? Because the goal is to figure out how we design policy and regulation to actually support these organizations. What's feasible, what's practical, what's cost effective, and what's actually going to be usable for these organizations.